Cancer remains a major public health concern in the Philippines and worldwide. It is not only a medical issue, but also a social and emotional challenge that affects families, communities, and healthcare system. The Cancer Prevention and Control Program are under the National Integrated Cancer Control Act or Republic Act 11215. We will discuss how we nurses play an important role in promoting awareness, early detection, and compassionate care for those affected. The Cancer Prevention and Control Program is a key public health initiative that aims to reduce the number of cancer cases and deaths while improving the quality of life of patients and their families. It is guided by the National Integrated Cancer Control Act or RA 11215, which ensures that all Filipinos have equitable access to cancer prevention, treatment, and palliative services. This program emphasizes three pillars of care: prevention, early detection, and access to quality treatments. As CHNs, we are deeply involved in all three, especially in educating communities, assisting in screening, and supporting patients throughout their journey. Cancer occurs when abnormal cells grow uncontrollably and fail to die when they should. These cells can invade nearby tissues or spread to distant organs, a process called metastasis. The danger lies in this uncontrolled spread, which can disrupt the normal function of vital organs. However, when detected early and treated promptly, many cancers are highly curable. That is why the national program focuses heavily on awareness and early detection. Early diagnosis literally saves lives. Cancer is consistently among the top five causes of death in the Philippines. The most common types include breast, lung, liver, colorectal, and cervical cancers. The rising number of cases is linked to multiple factors: our aging population, unhealthy habits, and lifestyle and environmental exposures, such as pollution and occupational hazards. This highlights the urgent need for public education, lifestyle modification, and access to screening services. Preventing cancer means addressing both personal behaviors and environmental risks. When it comes to preventable causes, tobacco use is still number one. Smoking and exposure to secondhand smoke are linked to multiple cancers, including lung, mouth, and bladder cancer. Alcohol use, unhealthy diets, obesity, and sedentary lifestyles further increase the risk. Certain chronic infections, such as hepatitis B, hepatitis C, and HPV or human papillomavirus, are also linked to liver and cervical cancers. Genetic predisposition plays a role too. But remember, most cancers are preventable through healthy habits and vaccination. Nurses must emphasize that prevention begins with everyday choices. The National Cancer Control Program, or NCCP, was established by the Department of Health to coordinate all cancer related efforts across the country. Under RA 11215, the NCCP was strengthened to guarantee that all Filipinos, regardless of income or location, can access affordable, quality, and timely cancer care. This includes not only hospitals, but also community level services like screening, health education, and patient support groups. The program's ultimate goal is to make cancer care inclusive, accessible, and holistic. The main goals of the National Cancer Control Program are straightforward but powerful. First is to reduce cancer deaths through preventive education and early detection. Second is to improve quality of life by ensuring that patients and their families receive medical, emotional, and psychosocial support. Third is to strengthen referral and support systems so that patients can move smoothly from screening to diagnosis to treatment and to follow up care. In public health nursing, we play a key role in every stage of this continuum of care. The NCCP uses a comprehensive approach that spans prevention to survivorship. First is health promotion and education, which focus on helping people understand and reduce their cancer risk through lifestyle changes. Second is screening and early diagnosis services, making sure that cancers are caught at the most treatable stage. Third is integrated management, including palliative care and survivorship programs, ensuring holistic support even beyond hospital walls. Together, these strategies create a continuum of care that covers every stage of the cancer journey. The cornerstone of cancer control is prevention and early detection. Prevention starts with promoting healthy lifestyles, balanced diet, physical activity, no smoking, and minimal alcohol intake. Regular screening helps detect cancer early when it's most treatable. Vaccination against HPV and hepatitis B can prevent cervical and liver cancers, respectively. CHNs play a big role in health campaigns that raise awareness and encourage participation in screening activities. Empowering the community through education is one of the most effective cancer prevention strategies. The Department of Health promotes several evidence based screening programs. For cervical cancer, women are encouraged to undergo pap smear or visual inspection with acetic acid or VIA. For breast cancer, nurses teach BSE or breast self examination and promote mammography for women over 40 years old. For colorectal cancer, the fecal occult blood test and colonoscopy are the main screening tools. Our role is to educate, encourage participation, and ensure these screenings are accessible at the barangay and municipal levels. But once cancer is detected, patients must have access to appropriate care. Effective cancer control requires timely access to diagnostic and treatment facilities. These include surgery, chemotherapy, and radiation therapy. But treatment is more than just medical procedures. It is also involving palliative care, such as pain management, counseling, and emotional support. Nurses ensure that patients maintain dignity and comfort even when cure is not possible. Providing compassionate care at all stages of illness is one of the noblest responsibilities in nursing. Nurses serve as educators, advocates, and caregivers in cancer prevention and control. We teach clients about risk factors and screening, help organize screening events, and ensure referrals are completed. We also provide psychological support, listening to patients' fears and guiding them through treatment. Emotional care is as vital as physical care in cancer nursing. Nurses bring hope and stability during one of the most difficult times in a person's life. Beyond the clinical setting, partnerships with communities make a big difference in cancer control. Community participation enhances cancer prevention. Nurses can collaborate with LGUs, NGOs, and schools to organize cancer awareness campaigns. We can help establish support groups where survivors share experiences and motivate others. Mobilizing local resources such as barangay funds or private donations can sustain screening and early detection programs. When communities own the movement, cancer prevention becomes everyone's mission. Monitoring is essential to measure success. Nurses record and report cases through the National Cancer Registries, ensuring accurate data collection. By tracking screening participation, survival rates, and treatment outcomes, the DOH and LGUs can identify which programs work best. This evidence guides better policies and future health interventions. Community health nurses carefully document what directly contributes to national cancer control effort. To wrap up our discussion on cancer and cancer prevention, we have discussed that this condition remains one of the leading yet preventable causes of death in the Philippines. Through healthy lifestyles, early detection, and timely treatment, many lives can be saved. As nurses, we are the bridge between knowledge and action. We bring cancer prevention into communities, empower individuals to seek care, and stand beside our patients through treatment and recovery. Having said that, let us continue to serve with compassion, competence, and courage, because in every early detection, every health talk, and every act of care, we rewrite someone's story of hope and healing.